To another junior doctor, Dr. Kishan Rees, who is a guest of mine. Now, where does your sympathy lie? 81869 on the text or email nihal@bbc.co.uk. No surprises for learning where Dr. Kishan Rees's sympathies lie. Good morning, Dr. Rees.
Good morning, Nihal. Thanks very much for having me on your show. I really appreciate it.
No, it's great to get your opinion across. I have to say, though, I mean, with a lot of this, because this is the BBC Asian Network and there are so many Asians that work in the medical profession, I am very keen to kind of get the other side of this. I'm very keen to get,
I'm Asian, half English, so I could definitely relate to both sides of the story.
Yeah. Well, I'm keen to really, and this is for the sake of balance, because of course you have a huge amount of sympathy, because who doesn't need a doctor? Who hasn't come in to contact with a very diligent, professional doctor in their lives? We all have. My mother worked in the NHS as a nurse for over 30 years. I understand that. But I guess it's finding out some of the things that perhaps where the BMA are being a little bit unreasonable here.
Well, I mean, I think I should put it out there straight away that I have no affiliation with the BMA in terms of being a negotiator. I'm like many other junior doctors. We left negotiations completely to them, and so I can't really comment on behalf of the BMA from a junior doctor's point of view, from a on the front line point of view. I'm more than happy to talk about.
Yeah.
If you got any.
So do you feel unloved? Because that's essentially what Nehal was saying.
I'm slightly different. I feel very loved in the sense that I work in Lincoln County Hospital. I teach medical students. I'm not your typical junior doctor in the sense that I don't work the same hours and the same degree of intensity that Neha is working. And I hear her and I feel for her in terms of working 12 days straight and having a day off, or working 4 nights, then having a morning or a day to get used to it, and then going back onto days. You know, as you said, that does ruin your body clock. So I completely see where they're coming from. My personal position is one that I would stand to benefit from this. I think it's crazy that I'm in a position where I would get a 10% to 11% pay rise. And I spoke to your producer this morning earlier in the sense that, you know, personally, who wouldn't like a 10, 11% pay rise? But in terms of, for the profession, in terms of keeping the best young talent, in terms of in the NHS as junior doctors, a discussion has to be had that where both sides are listened to and where compromises are made.
I mean, Dr. Rees, can you explain to me how you are going to be better off with this? Because there is that 11% pay rise, and yet, of course, people are saying that the overtime cuts, Yeah,
I mean, because I don't work overtime in my job. Education is very much 9 to 5. You know, there's no nights, there's no weekends. So What the government is saying is for doctors that do jobs that are like mine, which are the minority, to be fair, is by no means most junior doctors. There will be a few junior doctors in the country that got a pay rise, and I am one of them. But that doesn't stop me supporting junior doctors, because as you've seen from the Junior Jedi video that I put out, and I've been tweeting to your account, I've got 12,500 views, and I think junior doctors do feel very unloved.
Yes. I mean, the thing is that you're then opposing it on principle, because you obviously don't stand to lose out at all, quite the opposite, in fact.
Yeah.
But would you admit that there has to be a compromise somewhere, because these working conditions have been in place for a generation?
Well, it's interesting. You've made some notes on that in terms of this is a contract that was put in 1990, but medicine has also changed. You know, patients are getting older.
Well, the numbers have changed. The amount of people you have to deal with,
Yes, absolutely. There's more patients. They're older patients. They're more complex. They have numerous medical conditions. They have polypharmacy, which means they take many different medications. Now, in that situation, yes, the contract would, in one respect, you could argue that the contract should change to reflect the fact that it's more stressful and it's more difficult. And I have a friend who left. He went to Australia after Foundation Year 1. That was in 2010. He works in Australia, and he, you know, if he stays there for half an hour or an hour more, it is easy for him to claim that back. Neha said, we're in a position in the NHS where we can't and we don't claim that money back. So, you know, all these terms like overtime payments, it's very misleading. Junior doctor is very misleading. Overtime payment is very misleading. So going back to your question, this this contract has been in place since 1990, and yes, aspects of it could probably do with changing, but it needs to be done in a way where everybody's listened to and fair negotiations are taking place. And going back to Anil's comment about nurses, saying from on the front line there are shortages of nurses, and that the government is wanting to take away bursaries for nursing students, and that wasn't something that was covered in your prelude to this. So if you'd like me to talk a little bit about that.
Well, I've had a discussion about this now, and that is to bring nurses who are studying in line with university students who do not get bursaries either. Therefore, a loan system, the government argues, the government would argue that more nurses would come into the profession. It would broaden it out because they would have more money to subsidise it if they got rid of the bursaries.
Well, I can see where you're coming from, and
But that's where the government's coming from, not where I'm coming from.
Sorry. So I can see where the government or where that position has come from, but it's that you've got to think of it in terms of a nursing student is not your standard university student. These are nurses that are working in our hospitals. They're working shifts as students, supporting nursing staff. So they're not in a position where there's not enough hours in the day for them to go off and get a job and supplement their income while they're a student. The nursing students do not have reading weeks.
But they're not going to lose. Sorry, they're not going to lose money, are they?
No, but it's a deterrent in terms of if you have to take...
No, but it isn't. But Dr. Rees, you argue this is exactly the same argument that was given about introducing student loans, that less students would go. And the statistics show that students from poorer backgrounds, there's been an increase in them going to universities, not a decrease.
Well, it's about social mobility as well. And if you want to talk about, in terms of medical students, if I know personally, and I can talk about me quite easily, when I was 18 years old, the prospect of taking on £100,000 worth of debt petrified me. My mortgage is £83,000, and I got out of medical school with £26,000 worth of debt. And I graduated in 2009.
But the scaremongering...
It's not scaremongering.
Well, no, it is. It is scaremongering because, of course, as I've just pointed out, more people from disadvantaged backgrounds went to university after the introduction of tuition fees.
Study medicine.
What does that mean? I mean, the fact is, because they do longer years, they do 7 years or 5 years. You do 5 years, don't you?
Yeah. They do 5, yeah. I mean, my concern is, I'm talking about,
But then you stand to earn more money, and you also have career security that most other jobs don't have.
Well, that's very interesting. In terms of career security, you did say, doctors have a job for life, and, once you're in, it's virtually impossible to get sacked unless you do something dastardly, which I heard on the way in. I would have to argue that point in the sense that revalidation and appraisal are processes that doctors have to go through. Every year we have to have an appraisal.
Rightly so. You hold.
Absolutely.
You have to. I mean, yes.
Absolutely. No. Don't get me wrong. I'm just saying to you that you said that it was virtually impossible for doctors to be sacked unless they did something absolutely dastardly. And what I'm saying to you is that we're not getting paid just for being in the job and not progressing. Every single year, a junior doctor is in their post, their responsibility and the skills that they will have will increase.
But you are arguing there is an argument that you could say that, but then equally you could argue, well, prove it by having the necessary training and pieces of paper and peer-reviewed things that say that you have progressed.
We're doing that.
Okay. Well, if that's the case, then that's what you should be paid for, not just being there for a long space of time. And that's one of the clauses here. That's one of the things the government wants to change.
One of the clauses that they want to change is they want to change it. They're talking about changing it to nodal progression points. So there's foundation program, which is the first 2 years out of medical school, and then there's core training, which is the next 2 years after that. So the difference between an FY1 and an FY2 does actually go up. There's in terms of responsibility, in terms of what your roles are. And there is, at the moment, there's already a system in place where doctors have to complete the necessary paperwork, they have to do appraisal, they have to do revalidation, as you quite rightly say we should. But I'm just taking it back to you in the sense that it's not really, you just get paid for being around more. That's not actually the case.
Guaranteed pay increases linked to time in the job are also to be scrapped. So are you saying that it doesn't now exist whereby you are guaranteed a pay rise because you have been there for a certain amount of time? Are you saying that that does not exist? Because if it doesn't exist, then it wouldn't need it to be scrapped.
I think this is all part of a bigger thing in terms of trying to get 7-day services. Do we really need 7-day services? Do you need to have ingrown toenail removed on a weekend? Do the public want that? I'd be interested to talk to some listeners
we do have,
going to call in.
But we do have, I mean, this is one of the whole things about I'm in work, Jeremy, was the fact that we do have 7-day services. I mean, you know, if I want to go and see a GP or if I want to go to hospital on a Saturday or a Sunday, they're not closed, are they? You know that as well as I do. So, I mean...
Yeah, and I mean, so that's why it's a little bit disingenuous in terms of some of the way that it's been reported in the media, that doctors aren't around at weekends. And you're right, the I'm in Work Jeremy campaign was very prominent in getting that message across.
OK. Dr. Rees, thank you very much indeed for sharing that with us.